Okay, also, you're gonna see a lot of patients that come to the clinic with knee injuries, ankle injuries, a whole bunch of different knee injuries. Ankle injuries generally are very simple. Either it's a sprain or it's a fracture, okay? Very rarely you'll have people that come into your clinic with chronic ankle pains, okay? And people that do, okay, they have a history of chronic sprains. And the primary problem is that either the navicular bone is slightly moved or talofibular ligament is stretched out and it's being compressed. So we'll talk about it. You want to start with the knee first or ankle first?
Knee.
The knee? Okay, that's how I used to read knee when I first came to the United States. Knee, can I?
Ankle. You started with ankle.
The ankle? Okay, let's vote ankle or knee. Ankle. Knee. The rest of them are libertarians, they don't care.
Hey, that's me.
Okay.
They don't care?
A whole bunch of bones, you know, and then bone. Okay, now, does this make sense to you guys?
Yes.
Tibia, fibula, navicular bone, talofibular ligament, more ligaments. Okay, now, when you spray your knee, your ankle, sprain your ankle, that's a very common injury, so that's what we'll primarily talk about, okay? This is what you sprain right here. So, when you get those people and, you know, you touch right at GB40, okay? Not GB60, not stomach 42, but GB40, they should jump off the floor, okay? Because that's where the ligament is sprained. There's three categories of ankle sprain. Category 1, which is just a mild sprain of talofibular ligament, okay? Then you have category 2, okay, which is a sprain and possibly some tear of the ligament. And category 3 involves a fracture. Now, when you sprain the knee, okay, generally speaking, it's this way that the knee will go, right? There's two different fractures can happen, okay? There can happen an avulsion fracture at the 5th metatarsal, and there also, this way, there can also be a fracture at the medial malleolus, okay? This is a pulling fracture. This fracture happens because your navicular bone compresses here. So it can fracture there. In some weird cases, rare cases, you also can get an avulsion fracture here. Okay, where this gets pulled. Very rarely from an ankle sprain you wind up people, they get fracture throughout the entire structure, okay, through both bones. Who can tell me why do ankle sprains happen this way more than this way?
Because the bones, where they meet on the inside, is more closer,
Because of this.
and it's more.
Because of this, there's much bigger muscles that pull from here than here. Okay, so there's more force that's coming from here, okay, than here, this way. Okay? How do you differentiate if a patient comes to you and says, Doc, I just sprained my ankle, I was running, you know, and I stepped on a rock, and my ankle went, and I can't walk right now. Okay, how do you know if there's a fracture or not?
Pressing the ligament.
ways to check if there is a fracture, okay? Number one way is if there's a fracture here, you're gonna compress here, okay? Right at GB40, where the bone is, where the fibula is. Okay, you grab it there and you push. If it hurts at the ankle, there's a fracture, okay? Here, same way. You palpate and you tap the bone distally. If it hurts in here, most likely there's a fracture. Fracture can be displaced or non-displaced. Okay, either way it's gonna hurt. Okay. Now the second way is you look at the color of the tissue. Whenever there's fracture, there's always bruising. There's not necessarily bruising with a sprain or a strain. Fracture, however, has always bruising. Why? Okay, well, why would the sprain just cause swelling and a fracture bruise and a swelling?
Because the fracture of the bone is broken, maybe the blood comes from there, somewhere.
Open to duct bone there?
Bone is very vascular tissue. Okay, ligaments are not. So if a patient comes to you, you know, with an acute injury, and you look at him, and it's big, swollen, bruised, most likely there's a fracture involved. Fracture could be non-displaced or displaced. Either way, it's gonna swell up and bruise up. Okay, now, non-displaced fracture, initially when you take the X-ray, it's not gonna show. Why?
The bone's not broken?
No, it is broken, it's a non-displaced fracture.
So you guys don't this yet.
When you first take a X-ray of a non-displaced fracture, okay, what does X-ray show? X-ray shows dense material, right? Calcium, bone, right? Okay, magnesium, calcium. Now, on a non-displaced fracture, there is no scar tissue yet. So it's very common for people to look at, they're not radiologists or orthopedists, to look at X-rays of non-displaced fracture and say there's nothing wrong there. But give it a couple more days, retake the X-ray, and it's very obvious where the fracture line was because the healing process has started. Okay, but with those patients, you will have bruising there. And if you tap the bone, okay, distally, if the fracture is here, you can tap it here. If the fracture is here, you can tap the bone distally. Okay, they will have pain there. They will have pain at the side of the fracture. Okay, so going back to talofibular ligament. Very easy to treat, okay, however, you need to treat properly. Now, in Western so-called physical therapy and sports medicine and this and that, there's only one treatment for this. There's actually two, but one is used primarily. Who can guess what? Eyes. Did you hurt yourself? Stick it in the eyes. Okay, well, we don't do that. Why don't we do that? Because it does absolutely nothing. Okay? They claim it takes away swelling. Well, it doesn't. Okay? Because as soon as you take it out the eyes, the swelling comes back. Secondarily, there's a reason why there is swelling. Why would there be swelling, and why would swelling be a good thing?
Brings the blood down.
Immobilizes it, protects it.
Immobilizes it. Yes. That's your body's natural mechanism to protect yourself. Okay? Just like, you know, you have a splint. Splint is an external thing to immobilize, right? Well, you get swelling from inside. And that's why with knee injuries, okay, when knee injuries come to you, or any kind of injury that comes to you initially, it's very hard to properly diagnose what the problem is because it's swollen, it's immobile, they can't move it. And it's done that way because it protects your body from further damage. Okay? Second